I'm here today at the Priestley Speed School of Morristown with Dr. Padavan to talk about a topic that is on everyone's mind, which is concussions. And there's a lot of myth that goes along with concussions. There's a lot of concern that goes along with it. The injuries in the NFL have put it really on, the headline, doctor, for everybody to be concerned about. And so we're going to maybe kind of break out some of the things about concussions. Dr. Padavan is with Atlantic Sports Health. This is our partner at Priestley Speed School. Also, again, these are the doctors for the New York Jets. And again, I've mentioned this in many contexts, but I don't know where you can find better physicians anywhere in New Jersey and maybe in the country than right here in Morris County, Atlantic Sports Health. I call it Atlantic Sports Health as part of it. Atlantic Health Systems is the overall name. So, Dr. Padavan, good to have you with us today. Tell us a little bit about your background. I know you're a primary care sports physician, but just tell us what that means and tell us how you got here.
Yeah, well, first off, thank you for those kind words, Jeff. So I got here, it's a little bit of a long story, but I'll make it nice and quick. Like you, passionate about sports, grew up playing sports, loving it, and I just try to mix the two together. So playing sports and taking care of people and primary care sports medicine really seemed to be that perfect fit between both of them. So I've been doing it now for 6 to 7 years, and as you said, I'm one of the team doctors for the Jets. I take care of some local high schools, and I love taking care of all the different levels, from organized sports to kids sports all the way up to the pros. It's really a lot of fun.
So, and that's a great background. You have a great background for what we're talking about, which is fantastic. So tell us a little bit about, right out of the gate, because I know parents are worried about this. Should my son play football? We'll just use that one, but we want to talk about all collision sports. But should they be playing football or should they forego it altogether?
So it's obviously a very controversial topic, and I'm biased. I love football. I love the sport of football. I take care of, again, high school footballers, college football players, and the pros, and I think it's a great sport. The reason why we play sports is to have fun, to stay in shape, to build relationships, and for that reason, I think it's a great sport to play. But there's ways that we can make sure our kids are protected, and that means, listening to your coaches, making sure that you have the proper equipment, making sure that you have the proper instruction in terms of tackling technique. All of these are really, really important to make sure that we can reduce that risk of concussion.
So, and that is good information. Tell us what, maybe to start it out, because I think a lot of parents, we throw the word around all the time, concussion, concussion, concussion. I'm not sure a lot of people actually know the definition. And so two pieces to this question. Tell us exactly what a concussion is, and then tell us how you get a concussion. Is it because most people think you got to have a head-to-head shot like in football, and there's no concern otherwise. So talk to us about those two things.
Two great questions, and the first one's kind of complicated. If you look up a concussion on the internet, you'll see very complicated definitions. The way I explain it to parents is it's a brain injury. Plain and simple, it's a brain injury. So it's dangerous, it's concerning. And like you said, you don't have to have a helmet-to-helmet or head-to-head hit. You can get a hit to the body. You could fall on the ground. All it takes is a force to be transmitted to the brain and cause these symptoms, which I'm sure we're going to go through in a little bit. So it's a force going across the brain that produces these symptoms. And really, what we always tell our parents, it's not like a structural injury. It produces symptoms that interfere with your function, your brain's ability to function. So memory, concentration, all imaging tests are normal by definition. So if you do a CAT scan or an MRI, which a lot of parents come in asking us for, they're normal by definition when it comes to a concussion. And you don't have to lose consciousness. A lot of people think you got to be knocked out or lose consciousness. The truth of the matter is that most people don't lose consciousness and get diagnosed with a concussion.
So I know a lot of people, like, when I first heard this, a lot of people think, what do you mean a hit to the body can give you a concussion? So maybe just help us understand that a little bit more. What actually happens and what goes on in the brain that causes the damage?
Sure. So we think, again, if there's a blow to the body, there is a rotational force that is placed on the brain, and that rotational force sets in motion some breakdown at the cellular level. It releases different chemicals in the brain, and that itself causes the brain injury. So that's the reason why we can't see it on our normal scans. It's really at the cellular level, and it's that rotational force. That's the same question that we get asked, well, how come helmets don't protect you 100% from concussions? And the reason is the helmets protect that direct force, but they don't protect against the brain kind of spinning or turning, which we think is the main cause of concussions.
Wow, that's incredible. So,
Yep.
you know, a lot of coaches are going to watch this. A lot of parents are seeing this. They all wonder, you know, you already said you don't have to be unconscious. You don't have to. So what are the symptoms that a parent or a coach should look for to determine, did they, you know, get a concussion? Now, if it's severe, you know to take the player out, right? But you may not even notice. I mean,
Exactly.
what are you looking for?
And that is probably the best question. That's the most difficult question. That's why we have so many challenges. Because first off, it's not easy, right? It's not easy to put all the responsibility on the athletic trainer or the coaches because it's very, very difficult. It's very, very difficult for us in the office. So what we're looking for is any major hit you should be critical of just to make sure that the kid's okay. If you see someone grabbing their helmet, that's not a good sign. If you see someone really slow to get up, that's not a good sign. If you see someone stumbling off the field or their balance looks like it's been affected, that's also not a good sign. We have a lot of times, we have these big football players that are emotional. Big, strong guys that just are crying on the bench, really upset, really irritable. Those sometimes are signs of a concussion.
Wow.
But what makes concussion diagnosis so hard is sometimes you can get a hit, but you don't have symptoms develop until a couple hours later. That's the whole evolution of concussions, which makes the diagnosis so hard.
So give us an illustration of that. What would develop a couple hours later? They're home now,
Yeah.
and a parent is with them.
Right.
What's the parent looking for?
Yeah, so they may start complaining of, you know what, Mom or Dad, I'm having a bad headache. I just don't feel right. I feel like I'm in a fog. They may feel nauseous. They may complain of dizziness. They may say that their vision is a little off. These are probably the most common symptoms: headache, dizziness, nausea, just not feeling right, in a fog, difficulty concentrating. Those are kind of the big ones that we always look for.
So let's say that happens. Parents there, it's after a big game,
Yeah.
kid took a hit,
Yeah.
no signs immediate.
Right.
Now this is at home. When do they pull the trigger? When do they, and what do they do? Do they call their primary physician? Do they go to the emergency room? What do they do?
It depends. So it depends on the time of the day. Obviously, you want to try to see someone who is comfortable taking care of concussions. If that's your primary care doctor, perfect. You go to your primary care doctor. If it's a sports medicine doctor like ourselves, then that's the case as well. After hours, it always gets tricky. The nice thing about a lot of the schools, they have an athletic trainer. They're well trained and they can kind of talk parents through some of the situations. But if you're unsure, that's when I always say go to the hospital. You're never making the wrong mistake by going to the hospital. Clear signs that we want to make sure a kid goes to the hospital: if they're vomiting, if they're getting more and more sleepy, if the parent's noticing that they're just not acting right, if they're slurring their speech, those are the reasons you go to the hospital right away.
So it was always said when I was growing up to keep someone awake.
Yeah.
Is that?
We've kind of moved away from that,
Okay.
you know. So again, if someone is really, really injured, they should be in the hospital. They should be monitored. But most of the time with concussions, you don't have to wake them up every hour. I know it makes us feel better, makes parents feel better,
Right.
but you really don't have to do it if we're dealing with a concussion.
Wow.
Yeah.
Okay. So if the parent or the coach or somebody suspects a concussion,
Yeah.
they go to the emergency room.
Yeah.
Is that their last stop? Will that doctor, can they trust? Can the parent say, because I know emergency room docs, you get anything from the guy that just came out of med school and because it was late at night and he got stuck with the hours, to the guy that is fairly experienced.
Yeah.
Help a parent navigate that.
Yeah, the reason why going to the emergency room is a good idea if you can't talk to your primary care doctor or a primary care sports medicine doctor is they will rule out anything that is acute or dangerous. So again, they may not give you the how to follow up or all the instructions about a concussion, but they'll make sure there's no brain bleed. If they have to do imaging, they'll consider doing imaging, and that will be done immediately. But afterwards, I agree. You should really go again to a healthcare professional that is comfortable taking care of concussions. They're very complex. It's really a team approach when it comes to treatment, and I'm sure we'll talk about treatment as well. But that's the first step to make sure there's no bleed. And again, if you don't have access to anyone immediately, that's a good place to go to.
So, quick question, because this is going to be out on social media and stuff. I mean, number one, I would tell the parents, I've experienced, you know, the best care here for our athletes, but also, you know, personally and whatnot. So, you know, if you're local, you want to be over here at Atlantic Health Systems, right? But what if they're looking at this and there's someplace else? How do they know if their primary care physician is comfortable dealing with concussions, or is that something you just ask the doctor?
Yeah, I think it's fair. Listen, if I'm not comfortable with something, I will tell my patients the truth. And the same thing with the primary care doctors. They're great. Some of them have a tremendous amount of experience dealing with concussions. Others are not comfortable, and they send patients to us all the time.
Okay.
Going back to one point you mentioned about the coaches and parents, because they're watching this, we always tell our parents and our coaches, if you suspect a concussion, Jack.
Yeah.
So if there's any suspicion, pull the player from the
play.
field. Do not let them play.
Right.
It's the best decision you can do, because if they get a second hit and they really have a concussion, that's when we're really talking about it being really dangerous and causing a longer recovery period. So if there's any suspicion, get them pulled out and get them in touch with someone who's comfortable taking care of them and diagnosing them.
So that leads us right into treatment, and then I have a question, a follow-up
Sure.
to that one about the old 3-strike rule.
Yes.
That you hear all the time.
Absolutely.
And but let's say somebody goes to the emergency room or whatever it is, and it's determined they have a concussion.
Yeah.
What does the parent do? What will the doctors do? What will happen from there?
It's a great question. Again, every concussion is a little bit different, but usually it involves some type of academic rest, whether it's taking a couple days off of school or doing less homework. We don't want our kids to exercise or work out, and that's not as a punishment. It's because exercise typically worsens concussion symptoms. So that's why we say acutely we don't want them to do any exercise. There's a lot of information about certain supplements that can sometimes help with headaches that we push and we like giving our kids. Again, we always tell our kids no Advil, no Aleve, no anti-inflammatories, because there is a risk of bleeding after a head injury with some of these medications. So we really stick with Tylenol. We recommend Tylenol if you have headaches and not the anti-inflammatories. And then it's time. It's time.
Yep.
Most first-time concussions take a few weeks to recover. With these recommendations, we want them to eat properly, sleep properly, hydrate properly, and rest. The electronics is always a big question with their parents, and we tell them just to minimize the electronics. Back in the day, we used to put our kids in a dark room, tell them to do nothing,
Right.
and we've really moved away from that, Jeff, because you take a high school athlete who's busy all the time and tell them to do nothing, they're going to go crazy. They're going to tell
It might be worse for them.
Exactly. They're going to drive their parents. So there's no real evidence behind that. So we want them to be as normal as possible, minus the exercise, and taking it easy with school for a little bit.
So somebody gets concussion, whatever the sport, whatever they're doing, and I was raised with the understanding too over the years, hey, if you get a third concussion, you're done with all sports, no matter what, 3-strike rule, you're out. Talk to us about that.
Sure. So that's a very common misconception. It's published in a lot of places, but our current literature states that, what we don't like to see, first off, we don't like to see any concussions, right?
Right.
The more concussions you have, we know that the higher risk that you may get another concussion, and that's what scares us. So if you have 3 concussions, you're 3 more times likely to get another one, and that's why it's very concerning. But when we have the conversation with our parents and our athletes about, maybe sports or contact sports is not a good thing, it's when they're taking longer and longer to recover.
Right.
So if you have that kid that comes in and is taking 7 months to recover because they still have those persistent headaches, they can't function in school, well then we're a lot more cautious with those kids.
Right.
And also if it's taking less and less contact to create these symptoms, Jeff, so meaning we all have seen a big hit and a big collision, but if it's now a small contact, whether they just bump their head or bump into a friend at school, and now you're developing all these concussion symptoms, that's a lot scarier. That's a big problem. Yeah.
So, all right, that's really interesting. So it's not necessarily the 3-strike rule.
Correct.
Depends on the individual.
Yes.
And depends on maybe the severity.
Correct.
Of the concussions.
Yeah.
So, and if it's taking a longer time, obviously that's a problem. So, talk to us a little bit about, we always hear football.
Yeah.
But are you seeing concussions from other sports?
Oh, yeah.
And what happens there? And same treatment, I'm guessing, all the same stuff,
it's
right?
It's all very similar between sports. Obviously, we pay a little bit more attention to the collision sports because that's where the risk of concussion goes a little high. But we see athletes in football, hockey, lacrosse. I've seen in volleyball, soccer.
Right.
It's really across the spectrum. But obviously, the contact sports have a little bit more head injuries.
Right.
Yeah.
So that's interesting. Let me ask you a question. Children, your children, would you allow them to play contact sports?
I would, yeah. I mean,
Okay.
I definitely would. It's a matter of, again, teaching proper technique, protecting them in any way we can, making sure they have the right equipment, making sure they're well coached. And again, it's about teaching our kids not to be overly aggressive at the young age. And I really do. I'm biased. I love sports.
Yep.
Played them all my life. So there's a lot of good to be done when you play sports, obviously.
So a coach, and now youth coaches, because NFL, you got cameras everywhere. Cameras in the sky, cameras on the sidelines, coaches, professional, doctors, everybody's there.
Yeah.
So you see everything. You go down to the high school level, you got at least an ATC, your high school coaches are trained, everybody's there. Okay, that's the next level. You go down to the youth level, less collision, less impact that way.
Yeah.
So you're going to have a less thing. But what does a youth coach, who's typically not trained in a background like this, they're doing it because they're a volunteer, they love doing it.
Yeah.
They see a hit, they pull the kid off the field, they get that part. What do they do? And it could be soccer, it could be lacrosse, it could be whatever. What tells them don't put him back in? And do they just leave him off no matter what because they saw a shot, or are there very specific things they can look at and say, I remember like looking at the pupils, do they dilate? Are they, what would you tell that coach?
Yeah, this is where it gets really, really complicated,
Yeah.
very difficult, and it's, again, not fair to put all that pressure and stress on our coaches and our athletic trainers, because it's really a team approach.
Yeah.
I always say, look at ask the parents, is your son or daughter acting their normal way? If they complain of any symptoms at all, don't put them back in. If you're unsure, pull them out and have them sit there. Have them sit there for the rest of the half or the rest of the quarter, and then ask them again, are you having any symptoms? But it gets really, really tricky. And again, if you're not trained, just keep them out until they get evaluated.
So you just made a great point that I want to point out to parents here. So, and to coaches, great idea to have, the head coach, obviously he's busy, whatever.
Super busy, yeah.
But if you had a coach on the sidelines, take that kid, hey, talk to the parents.
Yeah.
Ask these series of questions.
Yeah.
Is this normal? Is that not normal?
Right.
Bring the parent into the process right away.
Yeah.
Hey, tell us what you think.
Yeah.
I think that's a great idea, and you're right. Putting it on one person is tough.
It's really tough. Really tough.
I have a question for you. That there's a lot of athletes, high school level, collegiate level, not the younger ones as much, but they don't want to be taken out. They're going to sometimes minimize what happened.
Right.
They're going to say maybe even deny, or say no, I'm not really feeling pain, and they're going, it's just normal stuff after you get hit. Talk to that athlete for a moment on the dangers of if something like that happens to you,
Right.
and you don't respond to your body the right way. What are some of the dangers?
Well, again, I just highlight the fact that, again, a concussion is a brain injury.
Right.
So it's different than an ankle sprain or a knee sprain. You need your brain for the rest of your life. And so if you are playing with symptoms, and we have people who work closely with us, Jeff, that unfortunately, again, because a lot of athletes, like you say, just downplay those symptoms, and now we're talking about a brain bleed. They can't play football anymore, and it gets really, really dangerous. It takes longer to recover. So, I always tell people, I want to get you back on the field. That's what I do. I want you to enjoy football, enjoy your contact sports, but you really want to be honest with your symptoms so that we can get you back safely, and now we're not dealing with any long-term issues with it. And that's kind of the way I tell my parents and football players and all athletes, just to be smart about it, because this is your brain.
And that's tremendously good advice. I'm going to say do you think, because I do think, do you think that because the NFL has highlighted some really, we're seeing a lot at that level, there's a difference at that level on the level of the athlete, the speed at which they're going at it? Do parents need to be concerned when they see NFL statistics versus the high school? Can they be comforted in some way to say, they're not playing at the level that's happening at like that?
It's a great question, and I do agree that, yes, they're bigger, they're faster, they're stronger, the hits are more kind of forceful. And so, and the things we hear about in the media all the time about long-term effects,
Right.
which is very, very controversial. For our young athletes that have that, one head injury, one concussion, I'm always reassuring them in the office that you're not going to go and develop anything long-term. It was a minor injury. Don't listen to those reports out there, because there's so many variables that we're not taking into account. And so I do agree with that point a little bit, definitely.
Okay. What else, did I leave out, or maybe because I'm not thinking of it, anything else that you can think of that you'd want to say either to a parent, to a coach, to an athlete, or just general knowledge that we need to know about concussions?
Yeah, so again, I would say in terms of treatment, it's a multi-team, multidisciplinary approach. every concussion that walks into the office is different. So if someone's concussion really involves a lot of neck pain, neck discomfort, well, then we need to treat the neck to get them better. If some people are having problems with balance or dizziness or visual problems, we need to treat those areas. And sometimes there's these great therapists called vestibular-ocular therapists that can help that as well. People who have what's called a headache predominant concussion, we need to treat that differently. So really it's a team approach. Athletic trainers, physical therapists, physicians, coaches, everyone comes together to try to get the athlete better. The one question that I always get in the office is, how do we protect our kids?
Right, that's a great question.
And what do we do to protect our kids? And every year there's hundreds of articles being published to try to protect our kids, and there's certain things that we know are going to help. So making sure you have the proper fitting equipment.
Yes.
Every year I go to a game and a helmet spins off, and that the helmet was not the appropriate size. Simple
Right.
things like that are going to help. Again, listening to your coaches about tackling technique we know is helpful. And again, reporting your symptoms, and I think we've seen concussions increase only because I think there's better recognition.
Right.
Coaches are learning more about concussions, parents are, and we're just trying to be safe to keep the sport safe. And that's what I would kind of mention to your point there.
This has been fantastic information. I know the parents and the coaches are going to glean tons just from this conversation. And then, and I'll encourage you parents too to interact with us on social media or on our website.
Please do.
When you see this, give us some questions, give us some comments. We'll get Dr. Padavan back to answer some of those if we didn't cover everything you're thinking or questions that you might have. And Dr. Padavan, thanks for being with us today.
Thank you.
This is awesome.
Much appreciated.
Thank you.
Appreciate it.